Hi everyone, welcome to today's Medcan webinar. My name is Tanya Haas. I am the Health and Wellness writer and content producer at Medcan. I hope you are having a good day. Now, before I introduce our presenters today, I wanted to share some information. This presentation is being recorded and will be sent to you in follow-up emails. You can share that with your family and friends. And like all previous webinars, our recaps are found at medcan.com under Medcan Insights. Now, due to the number of participants we have with us today, we have muted all incoming audio. So if you do have a question, we hope to have some time for questions later on today. You can fill out a question in the little box on your screen or on your cell phone. You can submit your questions. Those will remain anonymous. And if we do have time, we will have our presenters review them and see if they can address them. Now, please remember the information today is for educational and information purposes only and is neither intended to be relied upon nor to be a substitute for professional medical advice, diagnosis, or treatment. Now, with all that being said, let's learn a little bit more about our presenters today. So this face may be familiar to those who watch Marilyn Dennis or who are our clients here at Medcan. This is Dr. Scott Gledhill, a senior medical consultant at Medcan. He's also an emergency physician at Toronto General and St. Michael's Hospital. He also partakes in cardiac surgical assisting, and you may have also seen him on TD Wealth. Dr. Gledhill, thank you so much for joining us today.
Thank you for having me.
And we also have Janet Sperling, who is a PhD candidate in biological sciences at the University of Alberta. She joined us last week. I asked her a number of questions, and we're really excited to share what she had to share with us. Her current research focuses on the description of the bacterial microbiome of 6 commonly encountered species of ticks. And she's also a patient advocate and board member of the Canadian Lyme Disease Foundation. We're really excited to share her research and her insights. So let's start right away. So what is Lyme disease? We here at Medcan have had a number of patients and clients interested in this topic, but what is it? We want to make that a little bit more clear today. So the definition is an inflammatory disease characterized at first by a rash, headache, fever, chills, and later possible other symptoms. So we're going to learn more about that. Now, these are the carriers of Lyme disease. And so I asked Janet to define Lyme disease, and this is what she had to say.
I consider Lyme disease to be a bacterial infection that's carried by ticks. So the important distinction here is that the tick can carry the bacteria, but it doesn't necessarily transmit the bacteria right away. So it's important to know that that's why we have such an emphasis on removing the tick really quickly. So we want to get the tick off as quick as we can. Now, the problem is we don't know exactly how long it takes to transmit the bacteria. We know that for Lyme disease in particular, it takes a certain amount of time to be able to transmit, but there are a number of other bacteria that can transmit right away.
So we're going to learn more about the different types of Lyme disease or the different spectrums of symptoms that one can have. Now, a lot of people have heard about Lyme disease because of celebrities, like some of these faces. We have Shania Twain, Avril Lavigne, Alec Baldwin, Ben Stiller, Yolanda Hadid. All of them have shared their experiences about their condition, and they're trying to raise awareness and more research. So perhaps that's why you're joining us today. Perhaps you found a tick while you're at the cottage. And so let's learn more about it. So I asked Janet, why is Lyme disease not as easily diagnosed or treated as other conditions?
There's a huge controversy because we do know that the testing really isn't very good at correctly identifying who has Lyme disease. So there's a large number of people who really do have Lyme disease without a question, and yet they don't have a positive blood test. They've put the bar so very high that in order to have a positive blood test, you have to have 5 bands out of 10 particular bands. And some people only have 4 bands. And actually some people have 5 bands, but they're not the right 5 bands. So this is why you can see that somebody who sees the test results and says, I have 5 bands, very specific bands showing that I have Lyme disease. I have the signs, I have the symptoms. The person says, I have Lyme disease. And yet, very strictly, I understand why the doctor is saying you don't have Lyme disease. But if it's not Lyme disease, then tell me what it is. It might not be exactly Lyme disease, but certainly at the Canadian Lyme Disease Foundation, we say that it's close enough. It's a very close fit to Lyme disease. And some people don't have Lyme disease, but they have maybe one of the co-infections. There's a lot of rickettsias, there's a lot of anaplasmas, there's Ehrlichia, there's a whole lot of other things that people can have. And when you treat them with the antibiotics, they get better. And they get better as though they had Lyme disease. So the person says, I have Lyme disease. But again, it's true. It's possible they really had anaplasma. But as a person, you don't care. You don't care what the doctor's going to call it. You just want to get better. And I think that's where a lot of the problem is, that we've got so narrowly defined for exactly what is Lyme disease. We're missing the big picture. And the big picture is the people just want to get better.
Thanks. So Scott, do you have anything to comment on that?
I would. I would reinforce exactly what she has said, and I think that my profession has perhaps been guilty of narrowly defining it, as Janet has said, and I think we've taken too strict a line on, well, if it's not exactly under these conditions and the standards, therefore it's not Lyme disease, move on, it's got to be something else. And I think that that's negligent on our part, to be quite honest, and I've been guilty of it in the past. I think that we're beginning to understand a bit more about the science of Lyme disease, and that we are not perfect at detecting it, and that it's great if the tests are positive and it confirms it. But I think we need to be a little bit more lenient at questioning whether things are still Lyme disease, even if those tests are negative. And if, as Janet alludes to, if the symptoms fit, then it's probably worthwhile considering treatment to see whether or not that improves the symptoms. So I think that you're going to see our interpretation of Lyme disease expanded and broadened so that it includes a greater set. And again, I don't think Janet mentioned on this particular snippet, but I've heard her speak to the fact that there may be other forms of Borrelia, other forms of that bacteria that we aren't actually testing for, but that may be causing Lyme's disease or a Lyme's disease-like illness, which should be treated similarly.
How has the knowledge, in the public on Lyme disease changed as you've grown and the research has grown? Well,
the research is still quite poor, and our ability to detect it and definitively define it has really not improved much. But I think that we're gaining a greater awareness. We're seeing certainly more cases that are Lyme disease or potential Lyme disease. We're seeing that this tick is the tick that carries the disease is expanding, that its regions in which it can be found is growing almost on a yearly basis, that if the tick isn't migrating, then it's on the back of birds that are migrating to new areas. And this rigid idea that it can only be found in particular areas around the Great Lakes is a misnomer. It's no longer considered correct. And this can be just about anywhere. I understand they're finding it in Muskoka. I understand they're finding it in the Kawarthas now. And I think that we need to sort of broaden our outlook at this disease and be treating it a little bit more on a suspect basis as opposed to having to narrowly define it.
Well, let's learn more about the ticks, the risks, the geography. So here's Janet speaking to these ticks right here.
Sure. The first thing I'm seeing is there's male ticks, and they're kind of hard and crunchy. So those are the ticks on the left. The second thing I'm looking at is the female ticks. Now, something to keep in mind about the male tick is they can't expand very much. So the female tick, if she is going to bite you, she's going to insert her mouth parts, and then the abdomen starts swelling up. So the longer she feeds, the bigger the abdomen gets, till they can get to be a fairly large kind of pale gray color. So it starts off nice bright orange. The longer the tick stays on, the more likely it is to turn into this kind of tan colored, engorged grape-like thing. So it's important that you recognize that if you can get that tick off before it even bites, you've really reduced your risk of Lyme disease to virtually nothing. And you can do that by covering up with long clothing, like light colored clothing, and then walk with a friend. And if your friend says, yikes, I see a tick, brush it off right away. Now, another thing to keep in mind is I'm looking at the top layer, the first two. I see a male black-legged tick and a female black-legged tick. Those are the teeny tiny ticks. And they're actually pretty hard to see. And the easiest way to see them is if they're moving. So you need to kind of keep in mind that your eye will pick up movement very quickly. So hopefully you can see it when it's walking on you before it's actually fed. The second line I see here is the American dog tick, and that's the Dermacentor variabilis. It's a much bigger tick. That's the one that most people are familiar with. We've always had a certain number of people getting bit by Dermacentor variabilis. It actually carries Rocky Mountain spotted fever. So it's unlikely to transmit Lyme disease, but it transmits other things. So if you get bit by the Rocky Mountain spotted fever tick, it's less likely that you would have Lyme disease, but your doctor needs to know, because now this is going to direct your doctor in other directions, and your doctor's going to be looking for different types of bacteria. And then the third tick that I see there is the brown dog tick, and that one we don't see a whole lot. At least I don't see it here in Canada very much. That would be something where it would be more like in a kennel. If you had a dog in a kennel and you brought your dog back from the kennel after you've been away, that would be a more likely time to see that. And then one thing to keep in mind when I'm looking at the black-legged tick on the top, and then the dermacenter tick, which is that middle one, those are the ones that you would find in Eastern Canada. So on the Alberta side of the Rocky Mountains. And in British Columbia, we have different ticks. So they're very, very similar. And, you know, basically from this aspect, you really wouldn't be able to see much difference.
All right, so we're going to learn more about where these ticks are located. This map is from the Public Health Agency of Canada. It shows higher risk areas, but what Janet was really emphasizing to me was that while there are higher risk areas in Canada, and Scott, you spoke to this, there is no area that is 100% safe from Lyme disease. Let's hear what she had to say.
And as far as Canada, there are risk areas where you are more likely to find Lyme disease, but you can find Lyme disease pretty well anywhere. And that's because migratory birds are dropping the Lyme disease ticks. So it's something to say that when, for example, I'm in Ontario, I have a much higher risk of running into a Lyme disease tick than I do if I'm in Alberta. But even if I'm in Alberta, I can still run into that tick. And in some cases, if you're expecting to run into the tick, you're at less risk, because now you know to do the tick check and you're kind of alert to all the signs and symptoms. The problem being, if you're in an area where it's less commonly encountered, both you and your doctor might completely miss the early signs and symptoms. You might not even recognize that you were bit by a tick.
So Scott, when people come to you, do you ask them where they've been and if they've traveled in Europe as well as Canada?
Yes, I do. And of course, it's a different form of bacteria in Europe. And specifically, if that's the one we're looking for, then we have to specify that when we're submitting samples to the laboratory, because it's a different test that they need to do to look for that particular version of the bacteria. You know, again, it gives us clues, but I would say it's less and less important to me where they've been, and the fact that they've been in contact with a tick is the important part here, because we cannot rule it out in any area. So if they have the tick, if they've taken the tick off and brought it with them, fantastic. We can submit that tick, or if we know that they're coming from a very high endemic area, we don't even bother submitting the tick, and we just assume that the tick has the bacteria, which is perhaps the safest course of action. If it's a low risk area, then we can submit it and find out. But if we can't find the tick, if they don't have it, if they've thrown the tick out, if we're not sure, I think you're better to err on the side of caution and assume perhaps that maybe this tick was in contact.
Right. Yeah, just to find a tick would be ideal, but look how small they are. These are very small species. So I asked Janet, what do we do when you find a tick? So this is what she had to say.
The thing is, we want to get that tick off as cleanly as we possibly can. We don't want to squish the tick and then, you know, push whatever bacteria are there into the person. So fine pointed tweezers are great. Some people have little plastic scoops and you can scoop it under the tick. But remember that the tick will basically set its mouth parts into you, and then your skin might start to swell up a little bit. So you want to push down on the skin gently, grab at the mouth parts, they're a long, pokey mouth part, and then pull gently. Don't jerk, don't grab, don't twist. But if you hold the tension and then count to 60, and you're going to count really fast if you're removing a tick, and you're probably not even going to get all the way to 60, but the tick will release. It'll release its mouth parts. And now you know you've released the tick in its entirety. Now, this is the ideal situation if we're a bunch of adults and we're sitting around. If you have a squirmy kid, I recognize that it's a whole lot more difficult. Or supposing it's in the ear of a dog or something like that. That's where I think the little plastic scoops are really quite nice, because you can come to your child and say, it's okay, sit on my lap. You can gently push the skin down with this little plastic scoop, scoop this tick, and then remember to hold pressure gently, and then the tick releases, and you have the entire tick. Now, supposing you break the mouth parts off by accident, kids are wiggly, it's still better to get the pumping part of the tick off. And so supposing you leave just the tiny little mouth parts in, it's like a raspberry prickle, it'll work its way out, or you go to the doctor. But make sure once you remove the tick that you wash it with soap and water, and you keep a really close eye on that spot. And some people, what they do is they like to just draw a little black line around it. And they can say, okay, if that goes outside the black line, I'm going straight to the doctor and I'm saying, this is the Lyme disease tick. I've got a rash. It's now over 5 centimeters in diameter. This is Lyme disease. And it's true that it might not be absolutely classic Lyme disease, but that rash in Canada should say to the doctor, this is Lyme disease, give the person antibiotics.
Scott, is that what you would say to your patients as well?
I would completely agree with that. Yes, exactly. Again, the sooner you can get the tick off, the better. And we know that if you're getting that tick off within the first 24 to 36 hours, that the chances of transmission are incredibly low. And you may still benefit from a prophylactic dose of the antibiotics, which is something you can discuss with your doctor, like any antibiotic. There are pros and cons. But I think in that situation, I myself would probably err towards a prophylactic dose of the doxycycline. I like the suggestion of possibly highlighting the area with a black pen, of a circle of maybe 1 to 2 centimeters in diameter around the insertion point where you remove the tick. If you know the tick's been in there longer than that, then yes, as you alluded to, you want to keep a very close eye on that area. And if you see any formation of rash, you cannot count on the classical target rash that we're showing pictures of here. That it's beautiful when you see it. It's classical. It's pathognomonic. The more common example is actually just a purely erythematous red rash that enlarges over time. And if that's happening, then as she said, I would completely agree. You need to assume that that's Lyme disease and treat as such without waiting for confirmatory testing.
And what happens if people come to you without a rash, or it's undecipherable, but they have these other symptoms that have been linked to Lyme disease?
So quite honestly, that I find is the more common scenario, that people present to me with the later stages, with the, hey, could this be Lyme disease? I don't remember a rash. I don't remember a tick, but I'm having A, B, C, D, and I understand these are all potential symptoms of Lyme disease. Is this possible? Well, that becomes a much more complicated definition. You can do the testing, but as I've already alluded to, the testing isn't necessarily confirmatory, and you can't exclude Lyme disease based on that. I do think that if you have someone who was previously healthy and suddenly they're developing joint pains and pains in their muscles, there's evidence of a recent onset of fatigue, you've got some neurologic conditions, I think that it's worthwhile having that discussion with your doctor, considering the possibility, was there wooded area contact, have you been hiking, have you been in the long grass, golfing, whatever the case may be, and look at the whole picture and decide what you think the risks or what the chances of that being related to Lyme disease, those symptoms being related to Lyme disease. And if so, considering a treatment with antibiotics to see whether that resolves it. Having said that, there are all kinds of other disease, right, that also present with this myriad of symptoms, and you can't simply say based on these symptoms, therefore it's Lyme disease. So it's a much more complicated situation if you don't have evidence of a tick or of that initial rash. But I do find that that's the more common presentation these days, and you can't say that just because no one had the rash or remembers having the rash, because the rash is painless. It could be on the back of your knee, and you would have no idea. It's not itchy, it's not painful. I think they go missed quite commonly.
Mm-hmm. All right. So when someone does visit you, Scott, and they say, please, I'd like you to tell me if I do have Lyme disease. Janet has spoken to the tests. Can you just walk us through a little bit of the diagnosis stage and the process and the treatment?
I can, but again, so there isn't a definitive way of defining it, right? It's not like I can say, oh yeah, you do this test, if it's positive, therefore you have Lyme disease. I think you have to look at the whole picture. You have to sort of look at the timing. When did it start? Did all these symptoms start at the same time? Was there any precursor? Is there a past history of similar conditions or similar symptoms that have been coming and going? Or was there a definitive, look, it started on this month, 4 months ago, I don't know why, but all of a sudden I'm fatigued. All of a sudden I've got myalgias, I've got aches and pains that I can't explain. I'm just not feeling as well. My memory is off. And then, of course, asking back from that, well, do you remember ever having rashes? Do you remember having a period of feeling like an upper respiratory infection? Did you have a fever at some point? So you have to put that whole picture together and kind of guesstimate what the chances are of this being Lyme's. You have to rule out whether or not it might be other things, such as other autoimmune diseases. There's lupus, there's all kinds of other presentations that also have a similar appearance to Lyme disease. If you're feeling like those options are less likely, I certainly agree it's worthwhile doing the testing. Great if it comes back positive, it's much more obvious. You can feel comfortable with your diagnosis and treatment, as opposed to you do the testing, it comes back negative, but you still have a high index of suspicion. Then you have to have a discussion about whether it's worth trying a course of antibiotics. And
then you've spoken about antibiotic resistance. So it's not something that you want to be taking lightly.
Absolutely. So, and we don't like to hand antibiotics without good reason. This is a 3-week course, a minimum 2 weeks, and usually a 3-week course of antibiotics we're committing you to if you are going to start it. Fortunately, doxycycline is usually well tolerated, but like any antibiotic, there is the potential for side effects. There's a potential to throw up your gut's biome and cause all kinds of other issues. So we don't like to loosely just throw everybody on this medication who may or may not have Lyme's. It's a matter of weighing all the risks and benefits and having that discussion with the patient to determine what's the best course of action for the individual.
All right, thank you so much, Scott. Let's now discuss preventing. So I did ask Janet, what would she recommend to people who are hoping to avoid this?
When you're out walking, try to keep to the middle of the trail. The tick will generally be along the kind of long grass on the edge. And of course, with kids, what are you going to do? Well, maybe give them a stick. And if they want to run a stick along, that's fine. You can throw the stick away and pick up a fresh stick. But try not to let your kids run their hand along the hedges. And that's sort of a likely place to pick up a tick. The other thing is try to wear light colored clothing if you possibly can. Make sure that you put DEET or the various other things like picaridin is another famous one. Take it seriously when you're out having your picnic. And as soon as you get back home, do a tick check. It's very important that you remember, especially if you've been out working in the garden, if you've been out camping, you're all hot and sweaty, go and take a shower. Because if you can take a shower quickly, sometimes you can wash the tick off even before it attaches. And then look for this tick in the funniest nooks and crannies. So in your belly button, in your ear, in your hair, all sorts of places. And your fingers will generally be able to feel it because your fingers are very sensitive. But ask a friend to take a look. And if you're camping and you think that you were bit by a tick, take it seriously. Make sure that you follow up on it. Don't just say, oh, well, whatever, everybody gets bit by ticks. It's something that we realize that it's a lot more serious than we understood previously. So make sure that you do your tick check, that you have tried to make sure that you take the tick off before it attaches. And if it attaches, get it off as quick as you can.
Okay. And then for pets, it's important for people to check their pets as well and talk to their vet about how to protect your pets from ticks.
Absolutely. And then something to keep in mind with the pets is I'm kind of horrified how many people let their pets on the bed. And I can tell you that it's pretty classic as an entomologist to have somebody show me a picture and they'll say, here on the white sheet, is this a tick? And I'll say, yeah, that's a tick. And it's because they allow their dog to come in and jump on the bed. And I would say that with your pets, try to keep your pet in your pet bed. And remember that if your kids are playing with the pets, check the pet before you send your 2-year-old to go cuddle with the dog.
We do have a few minutes for questions to Dr. Gledhill. Unfortunately, we don't have Janet in studio. So we have one question. Can they test the tick itself for Lyme bacteria? Why wouldn't this be used for a diagnosis?
So yes, they can test the tick for Lyme disease. I can tell you that very infrequently do we have somebody come in with the tick. If they do, it's fantastic, and it certainly helps us in trying to determine whether or not we made the right diagnosis or not. If it is coming from a area that is not considered endemic, then we can submit the tick for testing. If it's coming from an area that's endemic, then they won't bother testing it. They'll just say, look, we already know there's a 20%, 40% chance that the tick is a carrier, and therefore you should assume this tick carried Lyme's disease. So if it's coming from a non-endemic area, we submit the tick. The first thing they're going to do is try and identify the tick. Again, if it's not a black-legged deer tick, then they're probably not going to bother testing it for Lyme disease because the risk is so incredibly low. If it's a black-legged tick, and if they test it, and if it has Lyme carrier, or not necessarily Lyme, but the bacteria that causes Lyme disease, simply showing a tick carries the disease isn't confirmatory that you, the individual, have Lyme disease, right? So that would simply be an increasing your risk of suspicion. It might make you more inclined to try prophylactic therapy, and it certainly make you much more inclined to treat at the earliest signs or symptoms of Lyme disease. But Lyme disease is a disease of the humans, not of the tick. The tick actually doesn't get disease. So we can't use that to confirm the diagnosis of Lyme disease. We can use it to drastically increase our suspicion.
Thank you. So I did ask Janet what would be her key message for today's webinar, and this is what she had to say.
Yeah, my key message is that Lyme disease is very serious, and it has been misdiagnosed in the past. So we all need to have a really good understanding of what a tick looks like, how to avoid being bitten by a tick, and also we need to recognize that we need to go to the doctor if we're sick. Like, you get bit by a tick and you have any reason to believe you're sick, you go straight to the doctor and you have to discuss it with the doctor. Unfortunately, we're still at a point where some doctors will say, we don't have Lyme disease in Canada. That's an American thing. Or they'll say, wherever region you come from, they're gonna say, oh, well, we don't have Lyme disease here. Those other guys, they have Lyme disease, but we don't. And it's something for you to then go and check. And I don't think there's anywhere in Canada that you can't pick up Lyme disease. And remember that when you're traveling, a lot of people in Canada will be traveling in the States and they're not thinking about Lyme disease. Or they're traveling in Europe and they're getting the tick bite, they're getting the Lyme disease there. And our tests are not going to pick up European Lyme disease unless you specifically ask for the test. So if you're sick when you're traveling, make sure your doctor has the travel history.
There is our guest speaker, Janet. She was a wonderful contributor to this discussion. Scott, I want to thank you so much for joining us today. Is there anything else that you'd like to leave our listeners with?
No, other than to have an increased risk of suspicion. I think that we're recognizing that this is a disease that has gone perhaps underdiagnosed for too long. And if you have any degree of suspicion, and certainly if you come in contact with a tick, to have a low threshold to consult with a physician.
Great. Well, thank you so much, Dr. Gledhill. Thank you to Janet Sperling out in Alberta. And thank you to everyone who joined us for this lunchtime or late mid-afternoon webinar. Hope you all have a great tick-free summer.